Worcester. Well, as you're hearing earlier on, we got a tremendous reaction from you when we talked about traumatic births recently, and one of the people who contacted us was Joe Carthew. Now, had a difficult pregnancy, Joe, but come up with a way to help women who are having a baby. And she's in the studio this morning to tell us all about it. Joe, good morning to you.
Good morning.
We've been swapping parent stories, haven't we?
Yes, we have.
You've got a little boy, what, he's 7?
He's 7 now, coming 8.
Wow, they just grow up so fast, don't they?
I know, he thinks he's about 16.
Yeah, little Phoebe, she reckons she's probably about 30 by now.
Yeah, knows it all.
Yeah, exactly, but I love her. Let's talk first of all a little bit about the pregnancy, because for you it was a traumatic event, wasn't it?
Yeah, I had a very difficult pregnancy with my little one. I had hyperemesis, so I was sick for the whole pregnancy, really, from the beginning to the end. And then he was born at 34 weeks, so that was a bit of a shock.
Wow.
Very quick delivery, and really the whole experience left me with quite a negative view of pregnancy as a whole. I didn't see it as this amazing event that it ought to have been.
It's funny, isn't it? Whenever you watch a film or a TV show and you see any kind of birth, it's always this, oh, it's over with, there we are, little bit of a bit of a perspiration on the forehead. It's not like that at all for many women, is it? And it's very difficult, I suppose, really, because from that, you've then, if you're going to have another child, you've got that in the back of your mind, haven't you? Yeah,
pregnancy is a time of great change. There's a massive amount of change taking place in the body, and obviously then practically, you like you say, suddenly you've got this little life to look after, and it's a great shock. So if you can look after yourself during your pregnancy, make that as positive an experience as possible, then you'll be better prepared to look after baby and family, and then better prepared to go forward into your next pregnancy if that's what you choose.
There's plenty of information out there about what we should be eating and what we shouldn't be eating these days. And excuse me, and also the fact that that we've got to look after ourselves. But what exactly do you do? Tell us more.
Well, I'm a maternity reflexologist. I'm a reflexologist first and foremost, and I got into maternity reflexology. I trained with some midwives who use reflexology in their practice. It's essentially a very specialised foot massage which helps to benefit the whole body by bringing things back into balance, by lowering that stress response, lowering anxiety, and releasing lots of feel-good hormones so your body can do what it needs to do during pregnancy, and that's cope with the massive changes that are taking place.
Right, now, that's interesting, because when you think about reflexology, I was thinking about the head more than the feet. What's the actual benefit there of massaging feet?
You massage the person's feet, and the theory says that reflexology, by massaging the feet, you affect positive change in the whole body. If you look back through history, through cultures all across the world, you'll find records of people using foot massage for positive benefits, and it was put together to the reflexology that we work today in the last century or so, and reflexology practice is becoming much more popular, much more recognised. Even at some of the Birmingham maternity hospitals, they've used reflexology and trained their midwives to work as reflexologists as well as midwives.
And how does it help? What are the benefits exactly?
Primarily, it lowers that stress response. When you've got stress hormones in your body can't perform the way it ought to perform. You know what it's like when you're stressed. You can't eat properly, you can't sleep properly, you've got mood swings, you're tired, fatigued. Imagine going through all that and you're pregnant. So by lowering those stress responses, the pregnancy hormones can do their thing without being overpowered by all this fight or flight adrenaline response which is going through your body if you're feeling anxious about the pregnancy and anxious about the birth. So it's a beautifully soothing, calming treatment. I've had ladies that have come back from seeing their midwife, they're very anxious, almost in tears, and by the end of the treatment they've had a sleep, and they're refreshed and relaxed and feel much more confident with their body and its ability to birth the baby and to look after the baby.
So we're talking all this and the lead up to the birth itself. What about during the birth? Is anything available then?
You can get some midwives are dual trained, but that would be they'd have to be specially insured to work in the hospital. I do give ladies some techniques and show their partners some techniques that they can use themselves during the labour, and that they find that beneficial. Just a few little places to put pressure that helps relieve stress and helps people cope with pain. And then after they've had the baby, a reflexology session really helps just to make them feel good again, get them back in tune with their body after all this massive event that's taken place. They've just brought a whole new person into the world, and a lovely treat of having a reflexology session just calms them down and gives gives them the ability to cope with all this change that's taken place, and it feels fantastic as well.
Brilliant. Well, Jo, thank you so much for coming in and talking about this to us today. If you want to get more details, how can they?
You can look at my website, that's breathetherapy.co.uk, or you can give me a call on 0753 112 1199. If you look at Reflexology on the internet, you'll find lots of information there about maternity reflexology.
Cheers, Jo. Thanks.